Well, welcome everyone to our Innovations in Tobacco Control seminar series. My name is Joanna Cohn. I'm the director of the Institute for Global Tobacco Control. And it is my distinct honor to welcome and introduce today's innovation speaker, Dr. Armando Peruga. Dr. Peruga is a physician and a doctor of public health and an alumnus of the Johns Hopkins Bloomberg School of Public Health. It even had a different name, I think, at the time that he was here, but Dr. Peruga got his MPH and his Doctor of Public Health here at Hopkins. And he then began to work with the Pan American Health Organization and the World Health Organization in 1990. And ended up as the program manager for the Tobacco Free Initiative at the World Health Organization in the headquarters in Geneva up until January 2016. He is now an associate researcher at the Biomedical Research Institute of Bellvitge in Barcelona and a professor at the Center for Epidemiology and Health Policy of the University del Desarrollo in Chile. Dr. Peruga has over 70 peer-reviewed publications, and they have covered the gamut of tobacco control. He has written on the topics of smoke-free public policies, tobacco advertising, promotion, and sponsorship, e-cigarettes, tobacco policy implementation, surveillance of tobacco use behaviors, smoking cessation, health effects of tobacco use, tobacco industry interference, and others. And it was really exciting to see that quite a number of his publications are actually published in Spanish, which is fantastic. So I am very pleased to introduce Dr. Peruga to talk to us about his insights about the evolution of tobacco control. So Dr. Peruga, welcome.
Thank you very much, Professor Cohen. It's a pleasure to come back from time to time to one's alma mater. So thank you so much for the opportunity to be back, even if it is virtually for a little, for an hour or so. I've been invited to share my history of tobacco control, but before I do so, I would like to make two disclaimers and one acknowledgement. The disclaimer is obviously that I tell the story of tobacco control from my own experience, from belonging for 25 years to the WHO PAHO system. And so it's a partial view, obviously, because first I worked for most of the time in Latin America and then all over the world, but I have most experience in Latin America and in dealing with mostly governments as counterparts and not everyone. So my view is partial, so I don't pretend to tell story of tobacco control, but just my story of that. The other thing is that whatever I'm going to tell is things that I've witnessed, but that does not always imply that I have contributed to them. So nobody should feel that what I'm saying is because I had any part of it, but some yes, some not. The acknowledgement is that when I started tobacco control, working in tobacco control at PAHO at the end of the past century, I joined the person that was already working there, and she is obviously still very experienced in tobacco control. Her name is Heather Celine, and everything I will be referring to my time working at PAHO is some things that we did together. My presentation will have two parts. One would be about the experience itself, divided into sections. One, my experience in PAHO in Latin America from 1994 to 2006, and then later on in Geneva and WHO from 2007 to approximately 2016 when I retired from WHO, and then went on to work to Professor Cohen referred to. I'm going to begin to share my screen. There we go. Thanks a lot. As I was saying, I'm going to talk about my reflections on my history of tobacco control, and therefore I don't pretend this to be the whole history of tobacco control. And as I was saying, my presentation will have two parts. But before I do that, I project here my declaration of interest. Perhaps the most important thing is that all support for preparing and delivering the present lecture comes from my work at the institutions that Professor Cohen mentioned, including a consortium of centers for biomedical research on respiratory disease in Madrid, in Spain, and a grant that I received as part of the tobacco control unit in the IDIBELL in Barcelona to study tobacco imagery in primetime TV in Spain. So let me start by talking about what I should call my first decade in tobacco control. And basically, when I started, we discussed with Heather, that I mentioned before, what were the conditions of tobacco control at that point, and what we wanted to change in Latin America and the Caribbean. Basically, at the time, the focus was basically on delaying initiation and focusing very much on young people as potential smokers to avoid that and try to avoid it or delay it. And then in the smoker, and the approaches were targeting behavior change among individuals. As I said, cessation, professional aid to individuals to quit, or informing, and I'm using this word not as educating, but informing kids of the dangers of smoking, because that's what we were doing at the time. And the instruments that they were used at the time was mainly personal choice instrument, individualistic. And so we wanted to change that and be similar to what other countries have begun to do, which was to convince governments to use a different set of instruments, so basically public policy, to change not only the behavior, but the conditions of the behaviors and of the overall population, and not try to focus on any specific groups. And so we began basically to say things like we needed to go into the 5 Ps of the marketing about people, product, price, place, and promotion. And that's what we wanted to do to change that perception. The first opportunity that we had was in the 25th Pan American Sanitary Conference in 1998, which the Pan American Sanitary Conference is the meeting of all the health ministers every 4 years to select, now it's every 5 years, but then it was 4, to select the director of the organization, of the Pan American Health Organization, and then set the strategy for the next 4 years. And at this point, we presented a report which explained the policies that needed to for tobacco control, although at that point we were trying to emphasize bans on ads on TV and radio, because at that point, Canada, Cuba, United States, Venezuela were in that case, and we thought, little we knew at that point, that that was going to be an easy, long-hanging fruit, so to speak, but it turned out to be more complicated than that. And we recommended basically also in that report some institutional strengthening of the ministries of health, basically trying to convince them to recognize tobacco control as a top priority, develop comprehensive national plans, and have personnel, at least a minimum full-time coordinator to be appointed in the health ministry. At the same time, we were doing the same, trying to strengthen the capacity, the institutional capacity of PAHO. And by that time, we had appointed, in addition to the existing advisor, a regional tobacco control advisor, which a full-time secretary, and an operating budget. Don't laugh at the figure, because at the time it was a lot of money for us, which didn't have any budget of $30,000 every year. We had also 2 inter-country consultants working, one from Venezuela, the other from Argentina. We were trying to strengthen the network of, that PAHO as well as WHO has country offices in most countries. They have certain level of population. And in every country, we were hoping to have a focal point that will, among other things, will deal with tobacco control. And so that was first action that we took. And to help us in that process, it was very timely to have the World Health Report in 1999. And this was an important, because it talked about the double burden of disease. Until now, there was some interpretation of the epidemiological transition that countries that were in the developing phase will have only or majoritarily infectious diseases, maternal infant problems, issues, while when they got the population got older and urban, then they will turn into chronic disease. But that was not the case. The case is that in most of the developing world, you have a double burden. And that talk kind of allowed, quote unquote, countries and governments to begin to deal at the same time with the infection disease burden, as well as the NCD or non-communicable disease burden, and its main risk factor, the tobacco use. Also, at the same time that year, a report that was very timely was the World Bank report on curbing the epidemic, who was under the name of Governments and the Economic of Tobacco Control, who was basically written by 2 figures at the time and now that were Pravalja and Frank Chalupka, and with the coordination and leadership of an economist from the World Bank called Joy the Buyer. And it was very important because it explained to governments that tobacco was not a normal commodity, and that helped us to kind of focus from the quote-unquote personal choices strategy to the public health strategy or public policy strategy. And the report itself talked about the failures, 2 main failures of in comparison to other commodities. The tobacco market had 2 failures. In the one sense, it had externality. The cost of the decision to smoke was bared by others. And also, it didn't work. A perfect market, in theory, will have consumers make rational choice with perfect information, which was not the case with tobacco. Still is not the case tobacco today. There's more information than some decades ago, but still some misinformation. And especially smokers, when they become addicted to nicotine, it's difficult to understand that they're making a rational and free choice once they are addicted. At the time, also, we began to, or continue actually, resource mobilization. We started with the strong support from CDC, especially in the United States, in the area of surveillance, from Health Canada, which was at the beginning the institution that was funding Heather Selin. But with time, we also were able to bring on the Swedish cooperation and the Spanish cooperation, and we ended up with, at the time, it was an important amount of money of $1 million for 3 years. The other thing that we were doing, as I was mentioning before, is strengthening the network of focal points at PAHO offices, taking advantage that we were at that point integrated in the health promotion division. And because of the Ottawa Charter in 1986, PAHO had developed focal points of health promotion in almost every country office in the Americas. And we were able to talk to and engage them in tobacco control. Especially, I want to mention two people that were very active at that point in both health promotion and tobacco control, which were Fernando Rocabado and Julio Gonzalez. Julio was later very active and instrumental in Uruguay, as I will tell. In the year 1999, we begin to produce with CDC the results of the first global youth tobacco surveys in Barbados, Costa Rica, and Venezuela. An important thing, in which we didn't have anything to do with it, but it was important that Brazil created the regulatory agency for basically public health and with authority to regulate tobacco. The acronym from Portuguese is Anvisa. Later, they played an important role in something that I will explain. Also, at the same time, in the year 2000, under the leadership of the Director General of WHO, Dr. Brundtland, the negotiations for the WHO FCTC, the Framework Convention, were initiated that created, obviously, a very conducive climate for tobacco control. But at the same time, and obviously that, as you know, that ended up in 2003 with the adoption of the Framework Convention itself by the World Health Assembly. By the way, I want to mention that initially, Hopkins played a very important role in the conceptualization of the convention. A professor that was there at that time, Alan Taylor, was one of the inspirators of this convention. I just wanted to mention that. And in 2001, we had the opportunity to have a resolution approved by the Assembly of Ministers that talked about the basically the smoke-free Americas. We were trying to find one single policy that will kind of mobilize the rest of it, and smoke-free environments was the case. And the resolution indicated, that was approved by the ministers, that all countries of the Americas should become smoke-free environments and all workplaces and public places. And the PAHO Secretariat should strengthen the capacity to help countries to adopt and implement these smoke-free environments. In fact, that same year before the resolution was passed, we had a first meeting with Southern Cone countries to precisely strategize about this smoke-free environment, Smoke-Free Americas initiative. By the way, that year also, we had the first country with pictorial warnings was Canada. The second was Brazil. At the time, I think it's important to mention that the person in charge of the tobacco control program was Luisa Acosta Silva, that later became the head of the Secretariat of the FCTC. We continue to also try to publish on the tobacco industry, and Heather Celine did a magnificent job in preparing with other people this publication, Profits Over People, which was a little bit based on the repository of documents of the industry that were kept at the time, and it was a good story to offer all the manipulations of the industry in Latin America and the Caribbean. So that gave us opportunity. I mean, internally, it was important because it allowed PAHO to not only us, Heather and I, talk about the industry, but also have PAHO, because they were so worried. I mean, the document was reviewed from top to bottom by the legal department, and we had to justify everything that was there, and they became very at ease with the report, knowing that everything that we said was completely provable with documents. And also, I think, so we broke a barrier there in PAHO about talking and saying some things about the tobacco industry that was not easy until this point. And also externally had a great impact because the media was very keen on the report, and even they did some special programs in some TVs of some countries depicting what the tobacco industry was doing. And so that was a good thing to do. That year, Brazil became a high achiever in the area of the Empower, that I will mention later what it is, or cessation. Basically, they established a national quit line, and they have cost-covered nicotine replacement therapy through some cessation services. And so that was recognized later by the WHO as the moment in 2002 in which Brazil became a high achiever in that area. In 2003, obviously the adoption of the WHO IGTC happened, but also the first and second Smoke-Free American workshop, we did one in Jamaica and one in Uruguay. And what the workshop did was basically define smoke-free, what was legally, what should the law say about smoke-free environment. It was designed the workshops to facilitate the partnership between government and civil society. And it was also to, as a product of the workshop, the participants representing government and civil society should agree on a plan of action with the specific deadlines. And the second one was happening in Uruguay at the time. Very active people in Uruguay were present. Eduardo Bianco, probably it's a name familiar. Adriana Blanco, who is now also the head of the Framework Convention. And in the ministry, Winston Abascal, persons like Ana Lorenzo Diego Stoll were very much active in promoting what later became, 2 years later, the second country in the world to be completely smoke-free. That same year happened that the pictorial warnings that Brazil had approved in 2001 came out stronger, bigger, with all the elements that were required and what would be the FCTC later. At that point, it was only under discussion. And also an important thing that many countries are still lacking is a national committee, an intergovernmental committee that will allow coordinating the different departments of the government. So tobacco, in fact, became a whole government issue and not just a health issue. I wanted to mention that continuing with the Smoke-Free Americas, we published, we had worked with 7 countries producing data on nicotine in the air in all the places. And basically we published with our colleagues at the time in Hopkins, like Anna Navas and Patrick Greasy and Francis Tillman and Jonathan Samet. We published in JAMA a very important article, not so much for the data for us, but because it was the first time that we were able to produce and document the situation in all these countries. And we were able to say that nicotine was detected in most places that were surveyed, so it was a common thing. And non-smoking areas, we did a comparison, just the separation in non-smoking areas and smoking areas were not effectively protecting non-smokers. Now it's perfectly understandable, but then it was something that we had to fight with. There were high concentration of nicotine basically in 2 areas, bars and restaurants, and that called our attention to work on those areas. 2 countries were especially high in or priority targets, like Uruguay and Argentina. And also, nicotine levels tended to be higher in countries with a higher prevalence of smoking. Venezuela approved, this is all before the FCTC entered into force, also high-level warning levels, Victoria warning levels. 2005, the WHO entered into force with all the meaning it had in terms of mobilizing the countries in tobacco control. Actually, we received the PAHO team, tobacco control team, not only me or Heather, but everyone in Washington as well, in all the countries received an internal award called the Best Team Award to recognize precisely the support that PAHO country levels have, country officers have provided to the negotiation of the FCTC. I want to finish this first decade by mentioning that also thanks to the very intelligence of Heather Saline, we worked and produced a document called Exposure to Secondhand Smoke in the Americas and Human Rights Perspective, trying to take advantage. As you know, PAHO is not only a regional office for WHO, but also is the technical agency in health for the Organization of American States. And that organization has a system, including a commission, a court, to promote and observe and defend the human rights in the Americas. And this publication tried to mobilize the petition to promote individual petitions alleging violations of specific human rights. Again, Uruguay became the first country in the Americas, and I'm saying whole country because obviously the United States and Canada had already worked in some national jurisdictions, as well as Australia. But it was the second country after Ireland that became completely smoke-free, and Panama and Uruguay also approved very strong health warnings. So with that, we can say that this is basically the early hits for the smoke-free environment, cessation services, warning labels, and enforcement of tobacco advertising, promotion, and sponsorship. And in the Americas, it all happened in Latin America all before and about the entry into force of the WCDC. So what's, sorry, I went a little bit into detail. I want to, in this first decade, because it's probably the less known, I'll be quicker in this area of the second decade or beyond the first decade, which I probably should call the kind of a Bloomberg decade because the Bloomberg Initiative happened at that point. It started and was launched to help cities and countries to implement the Empower, and I'll mention immediately after, in collaboration with global partners like including Hopkins, obviously, CDC, Tobacco Free Kids, WHO, and International Union Against Tuberculosis and Lung Diseases. By the way, currently the initiative spans more than 110 low and middle income countries, although they prioritize some of the big countries of the world. And over the past decade, Bloomberg Philanthropies has invested more than $1 billion in fighting youth. So I think it was a big help at the beginning of the FCTC, and it was concentrating basically at that point in implementing what we call the demand reduction measures. And we had the first report on the global tobacco epidemic by WHO, which tried to accomplish two things. First, the report served to launch the Empower package, which every letter of the acronym corresponds to one of the demand reduction measures. And it also initiated a series of assessment under the correct assumption that whatever is not measured is difficult to change or even make it exist. So I think that the World Report on the Global Tobacco Epidemic now is appearing every 2 years. The last appeared in 2021, referring to 2020. And this year, I know they're already working in the report that will be launched next year. In 2013, again, some things that had an important impact was the illicit trade protocol was adopted, although it took a little bit more time to enter into force. It entered into force in 2018. Also, in relation to the Bloomberg Initiative, I think it's worth mentioning that in 2018, Bloomberg launched with other global partners to the STOP initiative related to stopping the tobacco industry undermining public health and tobacco control. And I wanted to mention in this decade a couple of things that I followed closely, and I won't spend much time in other things. But one thing is Uruguay. They adopted in 2008 and later in 2009 two measures that had a great impact, which was the first time that the pictorial health warning was 80% of the front and back of the package. And the other thing was the so-called single presentation, which was a requirement for packages. They had tried to avoid misleading terms, and the industry, like always, tried to escape the regulation by providing menthol with associating menthol with coral blue and so on and so forth. So the Uruguay decided that everyone should have only one presentation. So if X brand was X Gold or X Classic or X Ice Blue or whatever, that could not be. It should be only X, and it should be presented everyone. Obviously, that created a series of litigations in the country that were not considered valid by the courts, and then PMI, based on a bilateral treaty with Switzerland, where the headquarters of PMI resides, filed an investment arbitration claim at the so-called International Center for Settlement and Investment Dispute, kind of a particular trade court to decide on investment complaints. bilateral, by the way. And PMI decided that they alleged that this legislation expropriated the property rights of PMI trademarks without compensation, because obviously for them, 80% of the front and back didn't allow sufficient room for the trademark, and the single presentation requirement meant that they could not use, so they allege, could not use their brands, such as Marlboro Gold instead of Marlboro Red or whatever. The other thing, the other element that was important in their allegations were that these measures were not justified from the health basis. There were no evidence that they would produce any benefits for public health. And I always wonder why that is an important thing. If it's not going to change the consumption, why they should bring it to the lawsuit. But anyways, and they also claim a series of other technical issues in relation to the how fairly have their litigation be treated in Uruguayan courts, and something called the legitimate expectation of stable regulation issue and things like that. And in 2016, the claims were rejected. I think that it was clear that for the court that that was not the case, that they had not been expropriated their property rights, that it was justified, that the government had provided legitimate expectations, and that the denial of justice that PMI claimed never happened in Uruguay. No? Okay, and later on, there was some plain package was enacted in Uruguay, and there were some issues that I won't go into details. I just wanted to point now that it was happening at the same time that the Australian plain packaging issues were debated in the courts. Philip Morris Asia, China, and the plain package are in a similar type of bilateral investment court, and although it entered into force in 2012, and later the WHO panel rejected the claim. And I just wanted to mention that for two reasons. One, because it is a different system. It's not just based on investment law, but rather on regular trade law in which the complainants are countries and not companies. And the coinciding very much with the resolution of the claim in Uruguay, the WHO, the WTO, the World Trade Organization panel, said that the measures were justified by health concerns, and because they can contribute to reduce of tobacco product use, that alternative measures would not make an equivalent contribution, which was one of the claims of PMI. It was not trade restrictive and did not impinge upon the trademark owner's rights. The other thing that I wanted to mention is also probably a less well-known case in Brazil, because it happened basically at national courts. In 2012, Anvisa created a regulation to ban all tobacco flavors in tobacco, and the same year, the National Industry Confederation, which was is a organization that has all the industry heads there challenged in front of the Supreme Court in Brazil. And after 6 years, the Supreme Court rejected the challenges. Although it was a special case because it was a tie, there were 5 judges in favor of rejecting the challenges while other 5 not. So in case of a tie, the Supreme Court rejects the challenge, but doesn't oblige the inferior court to, doesn't become jurisprudence in technical terms. But still a very important thing because it's the first time that a country has really banned additive to such a land. And I wanted to finish in the next 5 minutes a little bit on my take on the achievement and challenges in tobacco control. I think on the one hand, an achievement is that the prevalence that you have here, the global trends of current tobacco use, and the estimates are by age and sex from 2000 to 2025. This is for all ages and all sexes, from 32, almost 33% to 20%. And this is for age 15 to 24. And you have also a decline, and both happen also in both sexes. So I think one important achievement is that we had a decrease in current tobacco use for all sexes and age groups. However, one has to say that probably this is a little bit less than one desired. If you project, for example, the tobacco use prevalence in all both sexes and all adults, it will go under 5% probably around the year 2060 if you project that and nothing changes, obviously, in terms of policy, which is longer than desired, obviously. And you have in WHO in 2010 established some targets for the world, in which they say that countries should reduce 30%, a relative 30% decrease in the tobacco use prevalence by 2025, taking as basis 2010. And the results that are estimated that will happen in 2025 is that 41% of the population lives in countries that will achieve that reduction, while 49%, almost 50%, will reduce the prevalence, but not as much as 35%, while 7% will not decrease the prevalence, or even in 2% of the cases, the prevalence will increase. So this is to say that the achievement is it's important, but still way to go. If you look at the implementation of tobacco policies and the Empower, this is basically what's happening, or what has happened since the first report in 2007 until the last report, including data from 2020. And what you have is a great increase of the population living in countries that have strong pictorial and large warnings. In terms of information campaigns, it varies quite a lot. It has been great, but it has gone down and it's coming out again. It's very variable because it's not legislation. So it depends very much on how much you invest every year in every country. And you have in yellow, you have the number, the percentile of population that is living in countries that are completely smoke-free.
and you see that is increasing. This is a little bit deceiving, though, because in some countries that Empower doesn't classify at the top level, still they probably are, but it's difficult to ascertain. So if you look at the star, that's just adding India, which has a strong smoke-free environment, at least in the legislation point of view, will increase that percent of the population. What is clear is that the percentage of population living in countries that are implementing effectively the enforcement of tax bans or taxes at a certain level is still quite sluggish. In fact, the FCTC order or did a implementation assessment, and they came out with 3 tiers of articles. At the top level, Article 9, which is the P in Empower, Article 11, which is the W, the health warning, and Article 12, which is the other W in the information campaigns are going okay. Intermediately, you have what we had indicated in terms of the taxes and the Article 13, which is related to the enforcement of advertising, promotion, and sponsorship bans. And what countries are doing, which is not reflected in the Empower, but I think it's good to point out, especially now that Bloomberg has launched this this STOP initiative, is that we still have a quite sluggish implementation of Article 5.3, which is the how to counter the undermining of the tobacco industry. And also, importantly, Article 9, as I was referring to Brazil courts before, in relation to the banning or eliminating or reducing the additives. One thing that is important to mention here is that the FCTC Article 9 has 3 components. One is related to the appearance of the palatability of the products, which the guidelines have been established and approved by the COP of the FCTC. And that's what Brazil was trying to do to implement them. And still many countries are not doing so. But also there's toxicity and dependency or addictiveness that have not been regulated by the guidelines, and the countries have not approved that in the FCTC, and obviously are not doing basically nothing in order to regulate the toxicity and the addictiveness of the product. And then you say to the right a lot of articles that are related to basically environment and other stuff that it escapes to the portfolio of health, and is a good indication that is not really a whole government issue yet. And just quickly, I wanted to finish in the last couple of minutes in relation to the achievement and summary of achievements and challenges, and so we can discuss that later in with the group. Obviously, I was mentioned the prevalence of smoking and exposure to secondhand smoke has decreased. The population is benefiting from at least one Empower measure, which has quadrupled since 2007. So there are policies that are being implemented at a good pace, others that not. Another thing, I think it's a good point to highlight is that policies have resisted the legal challenges under international trade and investment law, which was something that the tobacco industry was using as a way to stop the implementation of the FCTC. Now, the challenges, and with this I promise I finish, is that obviously we need to expedite the implementation of the demand reduction measure, particularly the ones related to the bans on advertising, promotion, and sponsorship, and taxes also important. One point that I wanted to make is obviously that the implementation of high taxes had been sluggish, but we have to remember that at least half of the population is living in countries that have decreased affordability in the last 10 years. So not enough, but in the right direction. I think the other second challenge, which is beyond the specific tobacco control policies. Sorry, I forgot to say that obviously the fight against the tobacco industry undermining tobacco control and the re-engineering of the of tobacco products is important in trying to advance the decrease of prevalence. One thing that we are finding is that in many countries, especially developing countries, there's still a lot of confusion about this false dilemma of health versus economy, in which they say basically that everything that favors the tobacco control, it goes against the economy. We've seen that a lot during the pandemics about other things, the COVID pandemic, and we know it's not true, and we need to get probably more engagement from UN agencies that are not health related and development agencies that have an important role in helping some countries, assisting some countries in trying to overcome this false dilemma. And finally, I wanted to mention that in addition to obviously implementation of the most effective demand reduction, we need to kind of rethink this approach to tobacco control instead of tobacco control under a comprehensive approach, more to an end game approach. And this means, in my view, three things, and there's a lot of discussion about the engagement is, but it's a shift in focus from controlling tobacco to ending tobacco, which is a slight change of mindset that government should become aware of. There's also an important, another thing that to add to the reduction of demand, the reducing the supply. I think that's something that is time to commit to. I think there are several countries doing the tobacco-free generation type of things, or the thinking lead on tobacco supply, and also very importantly, the reduction of tobacco outlets or points of sale. And I think probably the most controversial point of what I consider to be part of the end game is the need to disrupt the engineering of the tobacco products to drastically reduce their attractiveness, addictiveness, and toxicity, all of them, and the role that other tobacco products may play in the marketplace. With this, I will end. I think I went over my time quite a lot, so let's have time for some discussion now.
Thank you so much, Dr. Peruga. That's fantastic. And folks, please, we don't have much time, but feel free to type a question in the Q&A. And as people are doing that, I'll just say, I mean, I just really appreciated your big picture reflections on the last few decades and sort of key turning points and especially the accomplishments. And I think we should really be celebrating the achievements that you lay out on your last slide. It's quite amazing, and of course continue to work hard to address those challenges. So maybe while people are typing any questions, and we do just have a couple minutes, one intervention you mentioned, Dr. Peruga, was Uruguay's single pack presentation law, where companies like Marlboro can't have their Marlboro Red, Marlboro blue, green, they have to choose one, just one Marlboro on the market. I'm a big fan of that policy, and I'm wondering from, where you sit and your experiences, why haven't other countries adopted that approach?
Well, I think there was a lot of discussion if that was strategically the best way to go in comparison to plain packaging, which was kind of the competitor idea to that. And what has settled in most countries, including Uruguay, by the way, is that they had prepared now to go into the plain packaging idea to try to detract all the advertising and promotion of tobacco that the pack provides to the public. In Uruguay, they approve plain packaging, and so they get rid of the single package presentation, I believe. And the problem is that the industry, through the present government, has tried to weaken the health of the plain packaging by allowing some messages, inserts, and as well as to write propaganda actually in the actual cigarettes, and which the courts have prevented. So far, they have issued an injunction to while they decide on the merits of the suit. But in the end, this is one of the points that why the enforcement of tobacco advertising, promotion, and sponsorship is not doing well, is because the use of the packages to do their bid for the tobacco industry is still quite strong. And health plain packaging is one way to go, but Uruguay tried through the single presentation.
Great, thank you for that. I'm afraid we're at time. So if folks have questions, you can reach out to Dr. Peruga. This was a fantastic presentation, and I really, just so you know, Dr. Peruga, we had people join us from across the world, and great. I just want to thank all the audience for joining in, for you for your wonderful presentation, and this lecture will be available on our YouTube channel in a few days. So please share it with your colleagues. It's a great lesson for nice to review things for people who have been around for a little while, and wonderful for people new to the field to understand where we've been. So I just want to thank you so much for sharing your insights with us, and thanks everyone for joining.
You're most welcome. Thank you very much for having me.